Wearing clean gloves and clean a firm surface. Remove and dispose the clean gloves. Practice hand hygiene. Remove the outside proper of the package by peeling the tabs apart where indicated. Place the package of gloves on the clean, dry, and firm surface at the outside surface at waist height. Maintain the sterility of the gloves by touching only the outside of the wrapper. Cross the edges of the wrapper and lift the edges up and away from the gloves, being careful not to touch the gloves as you open the package. Put one gloves on your non-dominant hand. With your non-dominant hand, pick up the opposite gloves by grasping the section that has a folded edge inside the cuff. The non-dominant hand should touch only the side of the glove. Lift the glove up and away from the wrapper. Hold your hands above waist level and insert your dominant hand into the glove opening. Gently pull the gloves into place with your dominant hand touching only the inside of the cup. Do not attempt to straighten but the glove fingers until both gloves are on. Dispose of the wrapper, keeping your hands above your waist level. Keep your hands above waist level if you need to adjust the butt gloves. Glove removal. To remove, grasp one glove at the heel of the hand with the other hand. Peel off the gloves, holding it to the palm on the glove's hand. Reach under the cuff of the remaining gloves with one or two ungloved fingers and peel off the other gloves. Discard the gloves and perform hand hygiene. That video is establishing and maintaining a sterile field, applying and removing sterile gloves. Instruct the clients to carefully clean his or her perineal area. This reduces the number of microorganisms at the urinary meatus which could contaminate the specimen. So, instruct a male client to retract his foreskin slightly if uncircumcised. Tell him to use a circular motion to clean the urinary meatus and the distal portion of the penis. So, instruct the clients to clean several inches down the shaft and to use each use the toilet only once. Then, instruct a female client to separate the labia minora and cleanse the perineum from front to back and to discard the towelette. Tell her to use all the towelettes, decides to usually 2 or 3, using each towelette only once. Ask the persons to start voiding. This flushes out any microorganism within the meatus. Place the specimen container into the stream of urine and collect the specimen. Make sure you do not touch the container to the perineum or to the penis. Collect the 30 to 60 ml of urine into the container. Cap the container tightly. Explain to the client that the throat swab may cause a tickling sensation or make her gag. Reassure her that the procedure will be brief. Ask the client to tilt his or her head back, open his or her mouth, extend the tongue, and say, "Ah." Depress the client's tongue with the tongue blade. Make sure you depress only the interior third of the tongue so that you do not initiate the client's gag reflex. Use a pen light to illuminate the posterior pharynx. Insert the swab without touching any part of the mouth or tongue. Gently but quickly swab the tonsillar area, making contact with any areas on the pharynx that are inflamed or contain exudate. Remove the swab. Do not touch any part of the tongue or mouth. Insert the swab into the culture tube, taking care not to touch the top or outside the tube. Crush the ampule at the bottom of the tube and make sure that the top of the culture is secured. Ask the clients to remove any possible contaminants from the oral cavity by brushing his or her teeth and or by using a mouthwash. Ask the clients to cough forcefully after taking several deep breaths, then expectorate directly into the specimen container without touching the sterile inner surface of the specimen cup. Have the clients repeat the coughing process until 5 to 10 ml of sputum have been collected. Ask the clients to remove any possible contaminants from the oral cavity by brushing his or her teeth and or by using a mouthwash. Ask the clients to cough forcefully after taking several deep breaths, then expectorate directly into the specimen container without touching the sterile inner surface of the specimen cup. Have the clients repeat the cupping process until 5 to 10 ml of sputum have been collected. This is the collecting a specimen for culture sputum.